We begin here this afternoon with news from local hospitals and a plea to get vaccinated. The surge in COVID patients in Oregon and Southwest Washington has reached levels never seen before.
Our Devin Haskins reports on where hospitals stand in the fight against COVID. And a warning here, this story contains some really blunt descriptions from medical professionals about the realities of COVID.
The ages of people that I put in body bags in the last couple of weeks are 20, 37, 42, 45, 52. I've seen a lot of people die.
Sometimes blunt is better. What you're about to hear is a personal experience from an ICU nurse from Providence.
Right now. And I'm asking people to know what I know and to see what I see. And it's hard because the general public doesn't see that. But if you've ever watched somebody drowned by coughing out pillars of blood because they eroded through an artery in their lungs, that's COVID. Watching people die without their family, that's COVID.
In Oregon, hospitalizations for COVID-19 are up 990% since July 9th. The main factor? The more contagious Delta variant. Around 85% of those testing positive aren't vaccinated. 283 people are in the ICU. That's 30 more than the previous day.
At the height of the surge last winter in November, we had 622 Oregonians in the hospital. Today, we have over 1,000 people in the hospital in the state of Oregon for COVID-19. And that's more than the day before.
Hospital admins say the surge hasn't even peaked this time, and they don't expect it to for another 10 days. And normal levels? Well, those might not come until sometime in October.
We've got a few weeks ahead of us where things are going to be really all hands on deck as we take care of our community. And then it should, the numbers suggest it should start slowing down and reversing, and we should see less patients in the hospital.
At PCell Southwest in Vancouver, they say they're running at about 92% capacity for both COVID and non-COVID patients. There's 69 hospitalized with COVID and 18 in the ICU. And when it peaks, they say it'll be closer to 90. So to help alleviate some of the pressure, Peace Health started sending non-critical patients home this week with oxygen tanks and monitors.
One of the instructions is going to be if you feel like you're worsening, if your heart rate is going up, if you're having increased work of breathing, no matter the saturations, to return to the emergency department to make sure that you are safe.
Health professionals say getting vaccinated now won't help cut down with the current surge, but it will for the next one that will inevitably come.
It's a lot easier to trust me and trust us medical professionals and get a vaccine than it is to trust me when I'm about to push a plastic tube down your throat, put you on a breathing machine. So please do us this favor and go get vaccinated.
The governor announced today hospitals and long-term care facilities will soon get some help in terms of extra staffing. The state is sending more than 500 healthcare providers to help with the rising surge of COVID-19 patients, specifically focusing on hospitals in eastern and southern Oregon. I'm Devin Haskins, KGW News.